Thank you, everybody, for joining us today. I'm Andrea Romero, Vice Provost for Faculty Affairs, and I'm so pleased to be here with Anne-Marie Chiasson, who's taking some time to talk to us today about well-being during and after the COVID-19 pandemic, considerations for our departments and ourselves. And I know, we're all here in this moment where we hope things would be different, but we're still in the midst of a lot of changes and transitions and trying to still understand what happened last year and how we're starting this year. So I think there's no better moment or time than to reflect on what we've been through, what we have still in front of us, and some of the strategies and the ways of thinking about how we even just understand these moments with Anne-Marie Chiasson. I hope will benefit everybody today. Anne-Marie is an MD, MPH. She is the director of the fellowship at the University of Arizona Andrew Weil Center for Integrative Medicine. She's also an associate professor of clinical medicine at the University of Arizona. She's board certified in family medicine, integrative medicine, hospice, and palliative medicine. She has a master's in public health from Johns Hopkins Bloomberg School of Health and an MD with honors from the Dalhousie School of Medicine. She currently serves as chair of the American Board of Integrative Medicine. I know for myself, I have heard Anne-Marie speak at least a couple times, and I found that it was incredibly helpful to understand the kind of challenges that we have faced, and even understanding my own level of deep mental and physical exhaustion that was sustained during the last year, and some great strategies for how to get through those moments and help ourselves and be able to help each other as well as we move into, coming back together while still maintaining our compassion and our generosity as we work together. So I'm going to go ahead and turn it over to Dr. Anne-Marie Chiasson to lead us through our session. Thank you.
Thank you so much for having me again. And I'm going to share my screen. And while I share my screen, if there's any problem with my audio, you'll let me know, right?
Yes,
yeah.
all good.
Okay. Thank you. All right. So welcome. So I'm gonna talk. Let me just give you an overview. I'm going to talk about well-being, what's been going on with in universities, what we've been finding, and I'm going to talk about personal well-being, and then I'm going to weave it back into departmental well-being. So we'll go through a bit of a journey. The CDC's definition of well-being, you can see here, it integrates mental health, mind, and physical health, body, resulting in a more holistic approach to disease prevention and health promotion. Now, I'm from the Andrew Weil Center for Integrative Medicine, so I have to sneak in a definition for integrative medicine here because we're really aligned with that. Integrative medicine is a healing-oriented medicine that takes account of the whole person, including all aspects of lifestyle. It emphasizes the therapeutic relationship between practitioner and patient and is informed by evidence and makes use of all the therapies. Can't give a talk without talking about our center. So today what we're really going to work with is how is your well-being? And I think we forget that we have to look at all aspects of our life when we're talking about well-being, not just physical, but also mental, emotional, social, financial. It's the whole package. I'm sure we could add 10 or 15 more things into this list. And I want to pose the question to you, can we experience personal well-being without a well community? Are we individuals or are we communal? And so we're going to talk about it from both perspectives, our own wellness, but then the wellness of our departments. So the definition of burnout, I like this. It was first described in 1974, syndrome of emotional exhaustion, cynicism or depersonalization, and low personal accomplishment. And I really want to focus in here on cynicism, because cynicism to me is really, it's the benchmark I use when I'm listening to myself and others. If cynicism comes in, to me, that is not just an attitude, but it's a symptom of burnout. And so it's very easy to pick up cynicism. Some of the rest of it is hard to pick up in ourselves and in others. I like this definition: the chronic inability to emotionally recover from distress at work and downtime. So you put in a good day, you go do your own thing at the end of the day, and you wake up the next morning and you're not refreshed. It's the inability to recover. So yesterday, I'm carrying yesterday's problems on my shoulders and last week's problems on my shoulders as much as the new challenges of the day. So we're going to start by looking at some data, and we're going to look at data on university professors. And this data is from before COVID. So this study was done in the Netherlands. They looked at 437 university professors in the Netherlands, and almost 25% scored for emotional exhaustion or burnout. The factors they found associated were early career stage, lower age, fewer years since appointment, and children living at home. There was an inverse correlation between emotional exhaustion or burnout and the level of professional engagement. So being really engaged in one's job is actually protective in this study. Now with COVID, you can imagine that, anyone who has children has had them home. So there's something that's bumped up, emotional exhaustion right there, and burnout. Here's a study out of Spain, 813 university professors in Spain, and the burnout factors they found associated with number of work hours, time in the profession. So this is opposite. The longer you're in the profession, the more burned out they found people to be. The number of daily hassles, COVID, hardiness. So the stronger people were, sometimes the more there was emotional exhaustion, which is interesting to me. The more they thought of themselves as hardy. Type A personalities, and adverse life events. Here's another, flag for COVID, because many of us have had an increase in adverse life events in the past year and a half. Social support and optimism inversely correlated to burnout. So here it is. If you're looking for symptoms of burnout in yourself, you can just look at, in some ways, cynicism and optimism. And I like to, I pitch my ear to that when I'm listening to people that I work with talk, or if I'm listening to my patients or to myself as well. Another study of 95 Italian university professors, and the increased burnout risk: women, younger age, and part-time professors. I think because of the burden. Other predictive factors were low mental and physical health and low positivity scores there again. It doesn't mean you have to pretend you're positive. This is what's innately flowing out of you. And the low mental and physical health here was not a result of the burnout. They did a multiple logistic regression, and they were independent risk factors. So the healthier we are, the more fit we are, the better we're feeling, the less burnout. So it's sort of what you're coming to the table with, and then what's being placed on the table. Now I'm going to talk to you about military data on burnout, because this is really what I found about leadership. So when they looked at military data, and this was on personnel that have been deployed to Afghanistan, they found correlations between the perception of professional stressors and the level of burnout, not the actual stressors, but the perception of professional stressors. And the protective factors were self-care, team care, general leadership, and health promoting leadership. So these accounted for less burnout, even when they looked at rank, psychological symptoms, and professional stressors. So the military's really looked at this, as they're often leading the edge on looking at relationships. And they really stress that there has to be health promoting leadership. And what does that mean? What is health promoting leadership? So now we go from, taking care of ourselves to perhaps we're responsible for our departments and how well they're coping as well. At the University of Arizona, this is a study done in England, 50% of people were working harder. Sleep is disturbed. Zoom burnout is real. And at the University of Arizona, quickly putting content online, we know, has increased our workload. And we've been uncertain about the fall and rapidly changing guidelines. So in addition to the normal stress of working in a university, which is what those studies were looking at, COVID-19 stress needs to be addressed, and there's long-term effects of the stress. So I'm going to go a little bit into that in a moment. This was the study out of England. I apologize. I get nervous when I speak. Looking at just working from home, significant increase in musculoskeletal complaints, so pains, back, feet, hands, poor sleep. There's a pretty much a consensus around the board that healthy diet and exercise has declined for many. And there have been extra stressors with concerns about work-life balance, job security, isolation. University of Arizona leadership reported that departments are more goal-oriented, yet working relationships are not as strong. So there's even less social support within our departments, and that people are working harder, but there was a sense that people are less productive due to more management and more time on Zoom, and that people are spending far more time each day, and that sometimes deadlines need to be shifted. So hopefully this will end soon, who knows? But even when it ends, we're going to have this hangover of this burnout that we're all experiencing on some level. Now, what are repercussions of being emotionally exhausted besides cynicism and some of the other things I described? This is a slide out of medicine. We know that in medicine, when clinicians are burnout, there are more broken relationships, more substance abuse, more depression, more suicide. And the thing is, not only are things more difficult, but we stop doing what's good for ourselves. So we have more stressors, and instead of doing what's better, what would take care of us better, we end up dropping it off. Just the things that we need, we end up cutting out of our life. It's this paradox, really. There's other data from medicine with decreased quality of care, decreased patient, i.e. student satisfaction, decreased productivity, but there's also physician turnover, which goes up. And I'm really interested by this because I have been reading online how many people want to quit their jobs and how many people are looking for new jobs. And I wonder if a piece of this is not just the burnout. Yes, we are knowing now that there's more freedom from working from home and all of these other things, but I think this is also a sign of sort of the burnout that we're experiencing in multiple areas of work, not just in the university, but in many, many different professions. So now I want to talk to you a little bit about stress, and I want to talk about what stress does. This next piece is a little bit of a dive into neurology, but please stay with me, because I think when you really catch a glimpse of what happens to the brain and stress, it really changes the way that we each approach it. So we know that stress affects the immune system acutely and long term. And we know that chronic inflammation is involved in most chronic diseases. But how does chronic stress impact the brain? And this is where I am just completely fascinated. With a lot of the new imaging studies in the last 20 years, neurologists can really get a look at what's going on. I'm not a neurologist, but I want to describe to you my understanding of it. In adolescents who are experiencing cumulative stress, it's been determined that there are smaller prefrontal cortex volumes, and that includes the anterior cingulate cortex, which I'll talk about in a minute. And it alters amygdala structure. So prefrontal cortex is how we make decisions, and the amygdala is function of the amygdala is really how we process emotions.
Apparently, I have. No.
I'm going to get them
Apparently,
to one of you. Yeah, thank you. So chronic anxiety decreases our cognitive flexibility and our decision making, and actually begins cognitive deficits. So, remembering that we're not thinking as well as we used to. The brain starts to change with chronic stress. There are a few other things I want to talk to you about. So decreased activity in the anterior cingulate cortex, and that creates attentional deficits and an inability to modulate emotions. So the way you were 2 years ago, or the way your department was 2 years ago, is not the way it is now. It may not be dramatic, but it's there for many, many people. So I would say that burnout score that we looked at of up to 25% may be much higher in our in faculty and staff. And then here's the other thing: there's reduced hippocampus volume in chronic stress. So the brain actually, the volume of the hippocampus becomes less, and this gives people hypervigilance add COVID into this. Am I wearing a mask? Are my hands clean? All of this, and increased propensity toward conditioned fear. So not only did COVID create this, but the chronic stress has created even more of this. Really interesting to me. So these things change. And what happens in the brain is that the brain has many parts. And in chronic stress, some of the parts that help us cope, the volume turns down. And then other parts that are conditioned in fear turn up. So parts of the brain get quieter than they were, for example, 3 years ago. I put this slide in, and this is the last neurology slide, which is there's changes in the subcortical, midbrain, and brainstem as well. And this, the midbrain includes, it is involved in our mechanisms of reward, punishment, and our dopamine function. So this is the piece where doing something that's good for ourselves may change because our reward mechanisms get out of whack. So it's difficult to think the way now for some people to think currently the way they were thinking 2 years ago. The brain starts to shift, the blood flow to the brain, the areas of the brain. It's all reversible, but we're starting in a really interesting, we're starting in a place of burnout. So when you go back to work, if you don't do anything to combat that, you're going to start back in person, with these shifts on board. So what works? Mind-body medicine this is the time for mind-body medicine. So some sort of stress reduction practice, because it turns those parts of the brain on. And I'm actually going to go through it with you because I really want to delineate why. To me, the more I understand why, the easier it is to get the other parts of myself on board to do these things. So guided imagery, mindfulness-based stress reduction, meditation, listening to music, breath work. We know that an anti-inflammatory or Mediterranean diet makes a big difference in stress. Exercise, having a meaning or spiritual or religious practice, so connecting to the meaning of your life, going out in nature, and staying connected to the meaning of the job. So here we're starting to go back into the communal. I take care of myself, and then how do I get my department to stay involved in the meaning of the job? So I want to go briefly through these interventions to show you how they really fix the brain or reactivate those quiet parts of the brain. So now I know everyone thinks about hypnosis, or often, at least in my generation, as somebody on a stage going, look at the watch, that's not really what hypnosis is. That's a form of hypnosis that is used for entertainment. But all hypnosis is self-hypnosis. And hypnosis really works through suggestion to have us recall or imagine a pleasurable autobiographical memory or create a pleasurable depersonalized experience. And that causes an increase in the prefrontal cortex back to making decisions. So it stimulates the parts of the brain that have gotten a little quieter. So hypnosis is associated with brain activation, not deactivation. So I'm not going to turn down the part that's afraid. I'm going to turn up all the other parts of my brain, and the part that's afraid is just going to be one voice in the chorus. Right now, it's a very loud voice, but when I turn everything else back on, it becomes a very quiet voice, and I can make decisions not just based on the fear. So functional neuroimaging studies support the use of hypnosis in the management of stress. This data is so good. It's amazing that we're not all doing it. I think it's because we're using the word hypnosis and we don't know how to access it. So my favorite, I'm moving on too quickly. So what does hypnosis do? It changes the anterior cingulate cortex, the prefrontal cortex, and many other parts of the brain. I want to talk to you for a minute about the anterior cingulate cortex. This is the part of the brain that gives you the goosebumps. This is the part of the brain that gives you the joy. And this is the part of the brain that really starts to regulate sensory and feeling and thinking and behavioral aspects of emotion. When I'm with patients, I just say, follow what gives you the goosebumps. That this is the piece. And if you get an experience of it in hypnosis and it turns it on from a fake experience, which is what hypnosis is, guess what? It doesn't matter. The fake experience works as well as a good experience. It also affects that part of the subcortical activity, which is involved with stress modulation and reward mechanisms. So imagining something will turn on the brain. just almost as well as doing it. Now, like I said, I think most people get turned off from the word hypnosis. Well, guided imagery is another form of hypnosis. We're calling hypnosis all sorts of things: yoga nidra, guided imagery. I mean, there are many, many guided meditations. There are many ways of talking about hypnosis. They pretty much all do the same thing at the basic mechanism. So guided imagery is what I use. I love it. Belruth Naparstek, who's one of the grandmothers of guided imagery, calls it the lazy person's meditation. And it works through the same mechanisms of action as hypnosis. Now, hypnosis usually is one person's voice, whereas guided imagery, they'll make a multi-sensory activity. Like, imagine yourself walking through the forest and you hear the birds and you can smell the rain on the dirt, and you'll go through a multi-sensory experience. And the more senses that are added in the guided imagery, the more we're recreating this pleasurable experience, which turns those parts of the brain back on. The imaging shows the same thing for guided imagery that we've already seen: the anterior cingulate cortex, the prefrontal cortex, and many other parts of the brain turn on from a guided imagery experience. This is something that's quite easy to do. And you don't have to do it that long. Belruth says, you don't have to do the 40 minutes, do 10, just do it. It's really remarkable. I'm going to do a short guided imagery experience with you at the end. I'll come back to that. So before I do that with you, I want to just put in a plug that there's a body of research now that shows that you don't have to be awake for this to work, which I think is amazing. So the brain is tracking what's going on even when we're asleep and when we're under anesthesia. This is data out of medicine, but I want to just show it to you because I find this so exciting that the brain will be stimulated even if we're like not paying attention. I'll just tell you this briefly. Elective hysterectomy patients, they were given positive suggestions during general anesthesia. The intervention, the control group was not, and they used almost 25% less morphine afterwards to control their pain. In abdominal operations, the gut shuts down when you get an abdominal operation. It takes a few days to wake back up and work. A 5-minute intervention where they were told about the procedure while they were asleep with headphones. And one group, they added support suggestions, positive suggestions into it. The group with the support suggestions, their gut started on average a day and a half earlier. There have been trials that have shown that suggesting to a patient that there will be less blood loss cuts blood loss during surgery back by 30%. Length of hospital stays are reduced. I mean, it's just amazing. I can't believe we're not using this all the time. And I think they are starting to use it in certain, I know I have a friend who's an OR, a pre-op OR nurse, and she suggests things to her patients. It's not a magic pill, but we know it affects what's going on. So why am I telling you that? I'm telling you that because you don't have to listen to the guided imagery. You can put it up, put your feet on your desk, and just close your eyes for 10 minutes, and it's going to do its magic. Now, I posed this question to one of our sleep experts. What about doing this on the way to sleep? Which, a lot of people are starting to do with Calm and some of the apps. Will it interfere with my sleep? And he said, that's a very good question. No one knows, but we can use guided imagery on the way to sleep while we're resting. I think you can even use it while you're running and exercising, and it will go in and start to create. You don't have to focus on it. It's going to do its magic anyway. It's just amazing to me. So I asked our expert in hypnosis and also Belruth Naparstek, our expert in guided imagery, how do I get people to do this? How should I do this? And they both said the exact same thing to me. I'm going to pull it up on my phone. They both said Insight Timer. Insight Timer is a free app. I think you can see it there. It's this little bowl. And there are literally 35,000 recorded guided imageries, guided meditation, hypnosis, from 2 minutes to 10 minutes to an hour, and you really only need a little. So you can just play around on that. And there are other apps. There's Headspace, there's Calm. I just heard, when we were getting started, I heard somebody talking about one as they were coming on to this session. Really useful. Should be mandatory in what's going on with our over-domestication. I think 100 years, we went out in nature, we went for walks, we did all sorts of things that would reset us and reset the parts of our brain. But in COVID, with the isolation, I think there's more and more that we need to do. Is there an alternative for individuals who do not have visual memory? That is a fantastic question. I will tell you that it works anyway. Not everyone can visualize. I don't visualize very well, but I can listen and use the sensory. So that's where I would use guided imagery. I can pretend I'm walking through and maybe get a sense and a feeling of what's going on. The words work anyway. About half of us see things in visualization, only half of us, and yet it still works. So that might be something with music and with rhythm, and also having an experience where you use your own autobiographical imagery, because you can remember things, and that way you can have imagery. So we do remember with imagery, but that's a great question. So I like this, but there's lots of ways to do it. I'm just going to show you Insight Timer for a second. Okay, so meditation. I'm going to get to the chat. Let me just see what the next chat is. With meditation, yeah, thank you, Adrian. With meditation, not that many people meditate. It's, people from the East say it's very difficult from the West, which is why I like guided imagery quite a bit. But meditation changes the brain if you're a meditator. Here's a study that looked at 12 long-term meditators. So they used 50 years of meditation or prayer for 30 to 60 minutes a day, and 14 non-meditators. And they did SPECT scans. They looked at blood flow in the brain before the meditation and then while they were meditating. And they found a few things. First of all, they found that long-term meditators had different blood flow in their brain anyway. And here's what I'm trying to build the case for. If you start doing it, it has long-term effects. Right? So they do it every day and their brains work differently anyway. However, so before, the long-term meditators had more prefrontal cortex and more anterior cingulate cortex blood flow. But during, everyone had an increase. Everyone had a change in how their brain worked. Frontal lobe activation and middle frontal cortex and a lot of other parts of the brain. So the authors asked, is this a chicken or the egg? Are those that are wired with different blood flow able to meditate? It's a good question. However, the fact that one meditation can have an impact for up to 3 months is remarkable to me. Now, I was forced to meditate as a kid. In the family, we did a meditation practice, and it took me a long time to learn to like it. But I've definitely noticed that there's a dramatic shift, in the last 20 years in how I respond to things. Guided imagery will do the same thing. And it's easy to find. There's always a way to find it. And you just find out, what do you like to do more of it. Here's the composite scan from that study for those of you that are visual. Here's pre and here's post. And you can see how the red areas are where there was more blood flow. You can see the shift. Doesn't look like a big shift, but actually it's a pretty dramatic shift. You can see before and after that there was more blood flow and more activity in the prefrontal cortex and the anterior cingulate cortex. So the data right now says 10 to 15% of the population meditates. However, if you add in yoga, if you add in prayer, if you add into running with a mantra, if you add in going into nature and just breathing, that number goes much higher. So don't limit yourself to meditation. The idea of meditation. I've just been reviewing the data for meditation, and the same thing in meditation can happen with chanting, with kirtan, with singing. So there's lots of ways to do it, but we need to do something to get our brain going back to the way it was when we were young, before it got out of whack, before stress showed up. And by the way, teenagers are stressed out now. I don't remember ever talking about stress. Maybe we didn't have the word, but I'm seeing burnout earlier in medical students. And I'm even watching my kids sometimes, talk about, being stressed out. Okay, enough of the guided imagery. I'm a little bit of a broken record about that. I just think that the data is so amazing. So another one's called the relaxing breath. We know that breathing helps. This has, it wasn't invented by Dr. Weil, but it's certainly been popularized by him. So this is a breathing technique where you breathe in and you breathe out. We'll do it for a moment. But the key is, if you exhale longer than the inhale, that's a relaxing breath. If you exhale and inhale at the same time, that's often a stimulating breath. And if you If you exhale shorter, that's a stimulating breath. So you just have to make sure your exhales are really long. So this is a wonderful breath. I'm going to show it to you. You breathe in through your nose to a count of 4. You hold for a count of 7, and you exhale for a count of 8. I'm going to show it to you. Looks like this. You put your tongue on the roof of your mouth and make a whooshing noise on the exhale. So I'll do it one more time and then we'll do it together. So you inhale, exhale, and hold, exhale. So try it with me. You only need to do 4. So we'll inhale, 1, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. Exhale, 2, 3, 4, 5, 6, 7, 8. Inhale, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. Exhale, 2, 3, 4, 5, 6, 7, 8. Inhale, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. Exhale, 2, 3, 4, 5, 6, 7, 8. One more. In, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. Exhale. That alone will relax you. And there's a body of research from something called Boiteco breathing, which has demonstrated if we're breathing too quickly when we're speaking, happens to be when I'm talking, we forget. All you have to do is slow down your breath. So the relaxing breath is a wonderful way of getting a quick shift of the sympathetic and the parasympathetic nervous system. Exercise, boosts brain blood flow, and it does a lot of the same things. It increases the gray matter in the frontal region and the hippocampus. So it stops the rumination and the worry and the hypervigilance, and it helps with decision making. We also know that it increases cognitive ability in adults and children. And for those of you that are getting older, it prevents age-related cognitive decline to some extent. Mediterranean diet, I'm sure you've heard about this a million times, but the Mediterranean diet has pretty much overwhelming evidence. It's too hard to talk about all of it. You can see all the things on my slide: cardiovascular disease, cholesterol, cognitive decline, osteoporosis, diabetes, obesity. But really what I want to point out to you about the Mediterranean diet, also longer survival, so decreased mortality. They did a study, and this fascinates me. They took healthy competitive athletes, so people who are already really fit, and they put them on the Mediterranean, they evaluated their mood, put them on the Mediterranean diet for 4 days, and then reevaluated their mood. And then they stopped the diet and reevaluated their mood again. And with these healthy athletes, just 4 days on the Mediterranean diet improved their mood. And when they quit, the mood went back. So eating is really important. And here's a picture. I'm not going to go through the Mediterranean diet too much. This is the anti-inflammatory diet, which Dr. Weil has developed. It's the Mediterranean diet with, he changed it and made it, included foods from other cultures, and it's fabulous. So, if you're stressed, you can eat your way into better mental health to some extent. I mean, that's an exaggeration, but really important. Having a religious or spiritual or a practice of meaning increases life by 8 years. When I first heard that, I just about fell off my chair, but it increases well-being. So here's another thing, staying connected to the meaning. And for some people, it's hiking. For some people, it's playing golf. For some people, their meaning is how well they're doing in their job. That's certainly one of the ways that I find meaning, how well I serve my students. So staying connected to meaning is extremely important. So I've gone over some of the things that matter. Hopefully I've focused in on the what chronic stress does to the brain. We're going to move into how to put this into our department and what we know. Definitely you need to ensure good sleep. There are other things we can talk about. But as we're returning to community, making sure that work, fostering meaning at work happens, that work is a community of meaning, not just a whole bunch of work that needs to get done. And there are lots of ways that you can do this. One of the ways that we do this, our executive director has us take 5 minutes at the beginning of our monthly meetings and sometimes our bi-weekly meetings. And she has us do a very short relaxation exercise or something that connects us to meaning. And it's not just the people who are the faculty, she has other people in the center do it. So we're learning about each other at the same time. We know that, one person showed us how to make a room more beautiful in 5 minutes, and one person had us color for 5 minutes. So we start our meetings with a way, with something to increase our well-being. And then we move into the work. It's really quite beautiful. So here's a quick exercise I want you to do just for a minute, which is, what would you do right now if I had to stop and go do something else and you had 10 minutes free? You can just add it into the chat. What would you all do if I said, oh, I gotta go? And I said, okay, I'll be back in 10 minutes. What would you do? Answer my email. You can put it if you want in the chat. Oh, somebody would do yoga in 10 minutes. That's great. What would you do if you had 10 minutes free? Go back to my desk, read the news, bio break, email. What would you do if you had 2 hours free? Unexpectedly, you had a huge departmental meeting and all of a sudden it got canceled. What would you do? Class prep for sure. Most of us go right back to work, read, get a snack. What would you do if you had a full day free? Go for a bike ride, relax, take a nap. So you can see, as the time frame I give you is longer, you start to do something for yourself. Nothing, I like that. Make pottery. I'm with you on that. So I give this exercise to our medical students because what I find is in burnout, we forget to do things that are good for us. And so I asked them this question: what would you do if I gave you 5 minutes off or 2 hours free or a full day free? And they say things like, I'm going to finish my other assignment. I'm going to go take care of this. I'm going to go right back to my email. Then I asked them, what would you do if I gave you a vacation for 10 minutes or for 2 hours or a full day? And the answers are all different. It's so interesting. So they start changing what they would do. And I actually give them a 2-hour vacation at that moment. And they come back like, that vacation was wonderful. If I just told them the next lecture was canceled, they would have come back in the same old way. So there's something about how we frame time off when we're burnt out that doesn't work. We don't frame it the right way. So I suggest that people start taking 10-minute vacations at lunch, something that'll really nourish you, regenerate you, instead of just going off and doing vacation the same way. I've given you a lot of things to do. Pick one new thing every 1 to 3 months. When I first started hearing this, I was like, how am I going to do all this? And the best advice I got was from someone I work with. And she said, just do one new thing every 1 to 3 months. You don't have to do it all at once. You have to do a mind-body practice. Follow what gives you goosebumps and reconnect to the meaning of your work and include your department in it. Now, before we move to questions, I have one other thing I want to go over, which I think is really important in stress. And I'm sure all of you have seen this. And this is Stephen Covey's time use map. He describes how very effective people and very effective organizations spend very little of their time in urgent and important work, 10%, and that they spend 70% of their time in the non-urgent important category, and very little time in the urgent but not important, and hopefully not very much time at all in the non-urgent, not important. And what I found what happened in COVID was that we all ended up, or quite a few people ended up spending all this time in urgent important. So we spent far less time in things that are preparation, prevention, planning, relationship. So we spent a lot more time putting out fires. That becomes a habit. So when I look at how I'm spending my time or how the people that I work with are spending their time in my own department, can we shift it from everything that's urgent and important all day long, putting out fires all day long, to not putting out fires and actually doing work of meaning? So let me show you a couple of fun things then. The last time I gave this talk, I had 1 hour and 45 minutes. So I didn't know if we'd get to this, but because everyone's so quiet, it's actually perfect. I get to the next piece, which is, I want to teach you some hand positions. Now this is something, and then we'll do a bit of guided imagery, and then we'll finish out. This is something that I use for myself that I've been sharing around the country that are really useful. So this is not Well, this actually has some correlations with neurology for sure. But if you look at sculptures, like I remember going through them at this, some of the sculptures, they're using different hand positions. They're ancient, and hand positions really help. So often, if I'm trying to get more engaged or use stress, there are hand positions I'll use in meetings under the table. Nobody knows I'm doing it. One is this. You take one hand, make a circle with these three and these, and put them together, sort of like that old thing we used to do as kids. Put them together and you put it in your lap. So you try it. So, the way you learn these things is you do it without, notice how you feel, then put your hands together, drop them in your lap. And from the perspective of really reflexology and also energy and lots of other things, this is a very calming position. There's no accident that we're looking at sculptures all over the world with these hand positions. They're the same hand positions that have been around for the last 5,000 years. They're mudras. So I love these. Here's one. So try it. Just put it here. And sometimes that'll shift what's going on. Remember, if there's cynicism going on with me, that's burnout. So how do I greet this moment without being cynical? I love this one. This is a great one. There are a couple of other hand positions I'll teach you. I know this is as out there as we get in integrative medicine, but I'm going to show this to you anyway because I like it. Here's another one that I like, which is a hand over the high heart and then a hand here. Now I would do that probably not in the middle of a meeting unless I put myself on, that's the great thing about Zoom is you can put yourself off camera and you can put one hand here and one hand here. Very soothing. So let's say, we just find out we have to put something else back online. I just soothe myself, really useful. And then the more I'm soothed, of course, the more those that are working underneath me can tell a difference just in the shift of my voice. So these are really fun little techniques we use. The other one we know that'll help with the brain is oxytocin. So when you use gentle touch on your own body, the way you would touch maybe a grandchild or something that you love on your face, it creates oxytocin. And oxytocin starts to stimulate that anterior cingulate cortex that we're talking about. So here's another thing that we can do just for a minute or two. Like, okay, here's a difficult meeting, or here's a big change we have to make. With as much compassion as you can. We have the most receptors in the face. Having a pet works too. That looking in someone else's eyes or looking at a dog's eyes creates oxytocin. So pets are one of the best things you can do for your mental health, for your brain activation, and also for your microbiome. But I just want to teach you some simple things that I use. I'll often sit in a meeting with my hands under the table, with my hands locked like this. Or I can turn off, let's say someone is really suffering and we're listening to some difficulty at work, I can turn off the screen and just put, like I said, one hand here on the solar plexus and one hand here. You have to try it, see how soothing it is. Okay. Some might call that wacky, but I love it. And then we're going to go into the guided imagery. See if there's anything else. Can I show again? Claudia, what do you want me to show again? I didn't see that.
The first one, sorry.
Yeah, sure. So look, the idea is that you're making a circuit from the heart. It's very calming. So you take your fingers and just make 2 circles and touch them together and then drop them in your lap.
Okay, thank you.
Okay. There's all sorts of them. You can go into any religious tradition and look at the sculptures and you'll see that they're doing some of the same things. Here's one that a lot of people do, but this is the one I like the most for relaxing. And I thought, wow, I don't have to think myself out of the stress. I can just breathe and do these relaxing positions and then do some guided imagery. It works so much faster than trying to think my way out of a stressful situation or out of burnout. Okay. So before we do this, I just want to, there's my email if you need me. It's my last name, chiasson@arizona.edu. I'm happy to provide service in any way that we can over at the Integrative Medicine Center, because this is what we do, part of what we do. And then I want to take you into Belruth's guided imagery so you can see how easy it is. It's not a very long experience. We have 6 minutes left. I'll play this for about 4, okay? So You can check your email, you can close your eyes, you can do whatever you want and listen to this because it'll start to work on those parts of the brain.
To begin with, see if you can position yourself as comfortably as you can, shifting your weight so that you're allowing your body to be well supported. You might even want to take a moment to really feel the support beneath you and to just let your body relax and settle into it. If possible, try to arrange it so that your head, neck, and spine are straight. And taking a deep, full cleansing breath, inhaling as fully as you comfortably can, breathing way down into your abdomen if you can, and breathing all the way out. And again, breathing in. And as you breathe out, letting any unwelcome thoughts that may come to mind float out with your breath, released with the exhale, so that for just a moment, your mind is empty. For just a split second, it is free and clear space, and you are blessed with stillness. And any emotions that are rocking around inside, those too can be noted and acknowledged and sent out with the breath, so that your emotional self can be still and quiet, like a lake with no ripples. And now, see if you can imagine a place where you feel safe and peaceful and easy. A place either real or imaginary, maybe somewhere from your past, or a place you've always wanted to go, or a place you visit now. It doesn't matter, just so it's a place that feels good and safe and peaceful to you. And allowing the place to become real to you, looking around you, taking the place in with your eyes, enjoying the colors, the scenery, taking in every detail with your eyes, and looking over to your right and over to your left, and listening to the sounds of the place, whatever they might be. Perhaps the music of moving water, or the sound of the wind in trees. Maybe birds or crickets singing, just so your ears can become familiar with all the sounds of your place that is so safe and peaceful to you. And feeling whatever you're sitting against or lying upon, whether it's sand or grass, a pine needly forest floor, or you might be indoors in a cozy armchair, or maybe outside sitting on a nice warm rock in the sun, and feeling the air on your skin, either brisk and breezy, crisp and dry, or soft and balmy and wet. Maybe there's just the subtlest caress of a fragrant, gentle breeze. Or perhaps you're indoors.
So I hope you got a sense that you can use memory to create those experiences if you're not visual. So when she mentioned the wind, I remembered a time I was on the top of a mountain being struck by the wind. Works really well. Anyway, I really want to thank you for listening. I want to wish you luck. I want to remind you that your departments are still working with the burnout that's occurred in the last bit, whether it's a little or a lot. and we need to find a way to get through it. Contact me if you need anything. Thanks.